Hello, everyone. Welcome back to our channel. I hope you're all doing well. Today, we have an important topic to discuss: the health of our hearts. Are you aware of the warning signs that could indicate your heart isn't functioning at its best? Well, you've come to the right place. In this video, we'll explore the 7 warning signs and symptoms that could suggest your heart needs attention. Did you know that cardiovascular disease is the leading cause of death in the United States and worldwide? It's a staggering statistic, and that's why it's crucial to pay attention to our heart health. 7 warning signs. Now, let's dive right in. We'll start with the first part of our video, the 7 signs you can see when something is wrong with your heart. Frank's sign. Our first sign, Frank's sign, is quite intriguing. Have you ever noticed a diagonal crease in someone's ear? Surprisingly, it could be an indication of blockage in the heart or carotid arteries. Dr. Sanders Frank discovered this connection back in the 1970s. While it's not a definitive sign, it's worth paying attention to, especially in younger individuals. Hair loss on legs. Moving on to our 6th sign, hair loss on the legs. Did you know that this could be linked to peripheral artery disease? When your leg arteries are clogged, it might be an indication of blockages in other crucial arteries, including those that supply blood to your heart. Xanthelasma. Have you ever noticed a yellow patch on someone's eyelid? It's called xanthelasma, and while it may seem harmless, it's actually associated with an increased risk of heart disease, heart attacks, and strokes. So, if you or someone you know has xanthelasma, it's essential to get a blood test to check cholesterol and triglyceride levels. Arch senile or senile halo. Our 4th sign, the arch senile or senile halo, is commonly seen in older individuals. However, if this halo appears in younger people, it could be a sign of severe dyslipidemia, an increased risk of heart disease. So, if you're younger and notice this halo, it's worth getting it checked out. Cyanosis. Cyanosis, our 3rd sign, is characterized by a bluish or purplish coloration of the skin. While it can be caused by cold temperatures, it might also indicate a heart or lung problem. It's crucial to pay attention to cyanosis, especially if it's accompanied by shortness of breath or other symptoms. Ulcers that don't heal. Moving on to our 2nd sign, ulcers that don't heal, particularly on the legs or feet. These ulcers could be a sign of poor circulation caused by arterial insufficiency. If you experience leg pain, difficulty walking, or persistent ulcers, it's important to seek medical attention. Swelling in legs, ankles, and feet. And now, the first sign that your heart might not be doing well: swelling in the legs, ankles, and feet. If you notice your shoes feeling tighter or your ankles appearing puffy, it could be a sign of fluid accumulation due to a weak or enlarged heart. Remember, gravity plays a role, so you may notice this swelling more later in the day. 7 symptoms. Fantastic! Now that we've covered the 7 signs, let's move on to the 7 symptoms you might experience when your heart isn't functioning properly. Shortness of breath on exertion. Our first symptom is shortness of breath on exertion. If you find yourself feeling excessively breathless during everyday activities, even with minimal effort, it's important to take note. This disproportionate tiredness might indicate an underlying heart problem. Persistent cough with white or pink phlegm. The second symptom to be aware of is a persistent cough with white or pink phlegm. This could suggest the presence of fluid in your lungs. Don't ignore it. Seek medical attention to understand the underlying cause. Paroxysmal nocturnal dyspnea. Have you experienced shortness of breath when lying down? If you find yourself needing more pillows or even having to sleep in a chair, it's time to pay attention. This symptom, known as paroxysmal nocturnal dyspnea, can be a significant indicator of heart problems. Generalized weakness and fatigue. Feeling tired all the time, experiencing generalized weakness, and struggling with everyday activities could be the 4th symptom of a weak heart. When the heart can't pump enough blood to meet your body's needs, it can leave you feeling fatigued and drained. Frequent nighttime urination. Host. Our 5th symptom, frequent nighttime urination, known as nycturia. While this symptom can have various causes, it's worth considering that excess fluid elimination at night might be related to an underlying heart issue. If you're experiencing this, it's important to consult a healthcare professional. Intermittent claudication. The 6th symptom is intermittent claudication. This refers to pain in the calf while walking, which eases when you rest. This symptom suggests that your blood isn't flowing adequately, and it might be due to a heart-related issue. Chest pain. And finally, the seventh symptom, chest pain. While chest pain can have various causes, it's crucial to consider the possibility of a heart problem. If you experience chest pain, especially with associated symptoms like sweating, nausea, or radiating pain, seek medical attention immediately. Prevention tips. Now that we've discussed the signs and symptoms, let's focus on prevention. Here are some valuable tips to keep your heart healthy and reduce the risk of heart problems. Engage in regular physical exercise. First and foremost, engage in regular physical exercise. Activities like walking, cycling, or swimming can improve circulation, strengthen your heart, and contribute to overall well-being. Quit smoking. If you smoke, it's time to quit. Smoking damages your arteries, increases the risk of heart-related issues, and harms your overall health. Take that first step towards a smoke-free life. Maintain a healthy weight. Maintaining a healthy weight is crucial. Excess weight puts additional strain on your heart, elevates blood pressure, and increases the risk of various health problems. Focus on a balanced diet and portion control. Focus on a balanced diet and portion control. Include plenty of fruits, vegetables, fiber, whole grains, and healthy fats like olive oil. Limit red meat and processed foods to maintain a heart-healthy lifestyle. Pay attention to family history. If you have a family history of heart problems, pay extra attention to your own heart health. Genetic factors can increase your risk, so it's essential to undergo comprehensive examinations and follow your doctor's advice. Take care of cholesterol and triglyceride levels. Taking care of your cholesterol and triglyceride levels is paramount. Consume foods that help lower cholesterol, reduce trans fats and saturated fats, increase fiber intake, and stay physically active. Medication may be necessary, so consult your doctor for personalized guidance. Control glucose levels for diabetics. For those with diabetes or pre-diabetes, controlling your glucose levels is crucial. This helps reduce the risk of complications, including heart problems. Aim for glycated hemoglobin levels below 7 and follow your healthcare professional's recommendations. Monitor and control blood pressure. Lastly, monitor and control your blood pressure. Keeping it below 120/80ths, or as advised by your doctor, reduces the strain on your heart and minimizes the risk of heart-related issues. That's a wrap, folks. We've covered the 7 warning signs and symptoms that might indicate a heart problem, along with valuable tips to prevent heart issues. Remember, your heart health is in your hands. Take care of yourself and prioritize your well-being. If you found this video helpful, please give it a thumbs up, subscribe to our channel, and don't forget to share it with your friends and family. Together, we can spread awareness and save lives. Thank you so much for watching, and until next time, stay healthy and take care.